Okay, so this time, looks like we are diving deep into the world of cardiac medications.
That's right.
Yeah, whole stack of meds here.
Yeah.
From those everyday blood pressure helpers to the heavy hitters for serious heart conditions. But don't worry, we're going to break it all down.
Yeah.
So you really understand how these medications work and why they matter.
It's really fascinating how each of these medications targets such specific mechanisms in the body, almost like a key fitting into a lock.
I love that analogy.
Yeah.
It really highlights how precise medicine can be.
Right?
So let's start with a class of medications that many people are familiar with.
Sure.
Beta blockers. We've got atenolol and metoprolol on the list. Just two examples of the many lols out there.
Yeah, beta blockers are like the chill pills of the cardiovascular system.
Okay.
They work by blocking the effects of adrenaline, a hormone that can make your heart race and blood pressure rise.
So by calming things down,
Right.
they lower blood pressure and make the heart work a little less hard.
That's exactly right.
That makes sense for treating hypertension.
Uh-huh.
But I'm curious about this note I see about atenolol and diabetes.
Okay.
It says it can mask hypoglycemia.
That's a crucial point,
Yeah.
and one that often gets overlooked, you see.
Okay.
When your blood sugar drops too low, your body usually sends out warning signals, like a racing heart and sweating. But atenolol can block those signals, essentially hiding the fact that your blood sugar is dangerously low.
It's scary. So it's not that atenolol is causing low blood sugar.
Right.
It's just making it harder to recognize warning signs.
Exactly. And that's why it's so important for people with diabetes who are taking atenolol to be extra vigilant about monitoring their blood sugar levels, perhaps relying on a glucose meter rather than just waiting for those telltale symptoms.
That's a great example of why understanding the nuances of these medications is so important. It's not just about what they do, but also about how they might interact with other conditions or medications.
That's right.
Now, speaking of important things to monitor, let's talk about diuretics.
Sure.
We've got bumetamide on the list,
Okay.
which is a powerful one.
Diuretics are often called water pills because they help your body get rid of excess fluid. By increasing urine output, this can be incredibly helpful for conditions like edema, where you have swelling in your legs or feet, or for heart failure, where the heart is struggling to pump efficiently.
So they're basically helping to relieve pressure,
That's a good way to put it.
both literally and figuratively. But the notes also mention something about potassium and diuretics. What's that all about?
Yes, potassium.
Okay.
It's an electrolyte that plays a vital role in many bodily functions, including muscle contractions and, crucially, heart rhythm.
Okay.
When you take a diuretic, you're not just losing water, you're also losing electrolytes like potassium.
So that's why we often hear about bananas and diuretics.
Right.
Bananas are a good source of potassium.
Exactly.
Yeah.
Incorporating potassium-rich foods into your diet can be helpful,
Okay.
but it's also important to monitor your potassium levels, especially if you're taking a strong diuretic like bumetamide.
It sounds like potassium's a bit of a Goldilocks situation.
Yeah.
You need just the right amount. Speaking of finding the right balance,
Right.
let's talk about carvedilol.
Okay.
It's a bit of a multitasker, treating hypertension, heart failure, and even helping after a heart attack.
Carvedilol is interesting because it's what we call a mixed alpha and beta blocker. It blocks both alpha and beta receptors, which gives it a broader range of effects.
Okay.
By blocking alpha receptors, it relaxes the blood vessels, and by blocking beta receptors, it slows the heart rate and reduces its workload.
So it's like a two-pronged attack on high blood pressure
Exactly.
and heart strain. But the notes do mention a potential side effect, weight gain.
That is a possible downside. And it's important to be aware of it. Weight gain can occur with carvedilol for a few reasons, including fluid retention and changes in metabolism.
Okay, so another thing to keep an eye on.
Right.
Now I'm noticing a trend here. We've got these powerful medications that can be incredibly helpful, but they also come with potential side effects.
Right.
It's like a constant balancing act, right?
Absolutely. That's why it's so important to have open and honest conversations with your doctor about your medications. Make sure you understand the potential benefits and risks.
Right.
And report any unusual symptoms or concerns.
Communication is key.
Yes.
Okay, let's move on to another medication that caught my eye.
Okay.
Hydralazine. It's a vasodilator, which I'm guessing means it widens the blood vessels.
You got it. Hydralazine is a direct-acting vasodilator, meaning it relaxes the muscles in the walls of your blood vessels. Allowing them to expand and improve blood flow, it can be very effective for lowering blood pressure. But there's one side effect that's particularly important to discuss: drug-induced lupus.
Lupus, it sounds serious.
It's not full-blown lupus,
Okay.
but it can mimic some of the symptoms,
Right.
such as joint pain, fatigue, and skin rashes.
Uh-huh.
The good news is that this reaction is usually reversible.
Right.
Once the medication is stopped.
Okay, that's reassuring.
Right.
But it highlights the importance of being aware of potential side effects and seeking medical attention.
Yes.
If you experience anything unusual while taking a new medication. Now, speaking of medications that require careful monitoring, let's talk about lisinopril, an ACE inhibitor.
ACE inhibitors are another common class of blood pressure medications. They work by blocking the production of a hormone called angiotensin II.
Okay.
Which normally causes blood vessels to constrict. By blocking this hormone, ACE inhibitors like lisinopril help to relax the vessels and lower blood pressure.
So they're working on a different pathway than beta blockers.
Right.
But ultimately achieving a similar goal of lowering blood pressure.
Exactly. And that's why it's important to understand the different mechanisms of action of these medications. Sometimes a doctor might prescribe a combination of medications from different classes to achieve better blood pressure control with fewer side effects.
It's like a tailored approach, finding the right combination of tools for each individual.
Yes.
But the notes mention a serious side effect of lisinopril.
Oh, okay.
Angioedema.
Right.
What exactly is that?
Angioedema is a rapid swelling of the tissues beneath the skin, often affecting the face, lips, tongue, and throat.
Okay.
It can be life-threatening because it can block the airways if you experience any sudden swelling in these areas. While taking lisinopril, seek immediate medical attention.
Wow, that's definitely something to take seriously. Okay, we've talked about a lot of medications that are used to lower blood pressure in general.
Right.
But I see one on the list that seems to have a more specific use.
Okay.
Methyldopa. The notes say it's often prescribed for pregnant people with hypertension.
That's right. Methyldopa is often considered a first-line treatment for hypertension in pregnancy.
Okay.
Because it's been well studied and has a good safety profile for both mother and baby.
That's great to hear. It's always reassuring to know that there are safe and effective options available for pregnant people.
Absolutely.
Now I'm seeing another lol on the list, metoprolol.
Okay.
We already talked about atenolol, which is also a beta blocker. Are these two basically the same?
They are both in the same class of medications and share a similar mechanism of action.
Okay.
But there can be subtle differences in how they're metabolized and how people respond to them.
So it's not a one-size-fits-all situation.
Yeah.
Doctors might choose one over the other based on the patient's individual needs.
Right.
And how they tolerate the medication.
Exactly. It often comes down to finding the best fit for each person, considering their specific circumstances and health history.
Now, I see a medication that seems to be pulling double-duty prazosin.
Okay.
The notes say it's used for both hypertension and something called BPH. What is BPH and how does prazosin help with both conditions?
BPH stands for benign prostatic hypoplasia, which is an enlargement of the prostate gland.
Okay.
It's a common condition in men as they age.
Right.
And it can cause urinary problems like difficulty starting or stopping the flow of urine.
So how does a medication that lowers blood pressure also help with urinary problems? That seems like an odd pairing.
It actually makes sense when you understand how prazosin works.
Okay.
It belongs to a class of medications called alpha blockers, which relax muscles in the prostate and bladder neck, making it easier to urinate. And as a bonus, alpha blockers also relax blood vessels, helping to lower blood pressure.
So it's a win-win situation.
Yeah.
Two birds, one stone. Multitasking medications are always impressive. Okay, we've got another beta blocker on the list, propranolol.
Okay.
The notes say it's used for a wide range of conditions, including hypertension, angina, arrhythmias, migraines, and even tremors.
Wow.
Is there anything this medication doesn't do?
Propranolol is truly a versatile medication.
Right.
It's a non-selective beta blocker, meaning it blocks both beta-1 and beta-2 receptors, which gives it a wider range of effects compared to selective beta blockers like atenolol and metoprolol.
So it's like a broader spectrum beta blocker hitting more targets in the body. But I'm guessing that also means a greater potential for side effects.
That's right. While propranolol can be very effective, it's important to use it cautiously in people with certain pre-existing conditions, such as asthma, because it can worsen breathing problems in some cases.
Okay, so it's all about weighing the potential benefits against the risks, as always. Now let's move on to another medication that seems to have a special role.
Okay.
Spironolactone. The notes say it's a potassium-sparing diuretic.
Right.
We've already talked about how regular diuretics can cause potassium loss, so I'm guessing this one is a bit different.
Exactly. Spironolactone is a very valuable medication because it helps get rid of excess fluid without depleting your body's potassium stores. Okay. It actually blocks a hormone called aldosterone, which normally causes the kidneys to excrete potassium.
So it's like a double whammy, fighting fluid retention and keeping potassium levels stable. But what happens if potassium gets too high? Is that a problem?
It absolutely can be too much potassium in the blood.
Right.
A condition called hyperkalemia can lead to serious heart rhythm problems.
Oh.
That's why it's crucial to monitor potassium levels closely when taking spironolactone and avoid potassium supplements, unless specifically directed by your doctor.
Okay. I'm definitely seeing a theme here. Potassium's a big deal when it comes to heart health, and it needs to be carefully managed. It's fascinating how all these systems in the body are interconnected, isn't it?
It really is, and that's why a holistic approach to medicine is so important.
Yeah.
We can't just look at individual medications in isolation.
Right.
We need to consider how they interact with each other, with other conditions, and with the person's overall health and lifestyle.
Well said. Okay. We're making great progress through this list of medications.
Try another one. Terazosin.
Okay.
Sounds a lot like prazosin, which we discussed earlier, another alpha blocker for hypertension and BPH.
You've got a sharp ear, terazosin, and prazosin are indeed very similar.
Okay.
In their mechanisms of action and uses, they both work by blocking alpha-1 receptors, leading to relaxation of blood vessels and the muscles in the prostate and bladder neck.
So why are there two medications that are so similar? Is it just a matter of different companies producing slightly different versions?
It's a bit more nuanced than that.
Okay.
While the overall effects are similar, there can be subtle differences in how individuals respond to each medication.
Right.
In terms of effectiveness and side effects.
So it's like having different options within the same category.
Right.
To fine-tune the treatment for each person.
Exactly.
Makes sense. Okay, last one on our list for this round is verapamil.
All right.
Another calcium channel blocker like diltiazem, which we talked about earlier. Anything new to add about this one? Verapamil is a potent calcium channel blocker that's often used for treating certain heart rhythm problems, like atrial fibrillation and supraventricular tachycardia. Okay. It can also be used for hypertension, but it's important to note that it can worsen symptoms in people with heart failure, so careful monitoring is essential.
Okay, so another example of a medication that can be very effective for some conditions, but needs to be used cautiously in others.
Exactly.
It's like walking a tightrope sometimes, finding that balance between benefits and risks.
That's a great analogy, and it highlights the importance of shared decision-making between doctors and patients. It's not just about the doctor dictating what medications to take.
Right.
It's about having an open dialogue, considering the pros and cons, and making informed choices together.
I completely agree. I think we've covered a lot of ground in this first part of our deep dive.
We have.
We've explored a wide range of medication.
Right.
From those that target blood pressure to those that affect heart rhythm. And we've seen how each one works in a unique way to address specific cardiovascular challenges.
It's been a fascinating journey so far. I'm eager to continue our exploration and delve into some other intriguing medications in the next part of our deep dive.
Me too. But for now, let's take a little breather.
Okay.
And let all this information sink in.
All right.
We'll be back soon with more insights and discoveries.
Yes, good. Welcome back.
We were just talking about potassium and how important it is for heart health.
Now,
I see another medication on the list that seems to be related to that amiloride. The notes say it's a potassium-sparing diuretic. Just like spironolactone, are they basically the same thing?
They both work by helping your body get rid of excess fluid without flushing out essential potassium.
Right.
But they do it in slightly different ways. Spironolactone blocks a hormone called aldosterone, while amiloride acts directly on the kidneys.
So two different mechanisms, but a shared goal keeping potassium levels in check while managing fluid balance. That makes me wonder, we've been talking a lot about potassium in the context of diuretics, but is it important for other aspects of heart health as well?
That's a great question. Potassium is absolutely essential for the heart's electrical system.
Right.
It helps regulate the heart's rhythm, ensuring those contractions happen in a smooth and coordinated way when potassium levels are too high or too low. It can disrupt the heart's electrical signals,
Right.
leading to irregular heartbeats or even more serious arrhythmias.
So it's not just about preventing muscle cramps, it's about keeping the heart's electrical system running smoothly.
Exactly.
That's a good reminder that even seemingly simple things like electrolytes can have a profound impact on our health.
It's true.
Speaking of keeping things running smoothly, let's shift gears and talk about nitrates. We have isosorbide mononitrate on our list.
Nitrates are fascinating. They're like little messengers that tell the blood vessels to relax and widen,
Hmm.
allowing for improved blood flow. This is particularly helpful for conditions like angina, where chest pain occurs due to reduced blood flow to the heart muscle.
So they're like tiny traffic directors, easing congestion and ensuring that blood gets to where it needs to go.
I like that analogy.
But I noticed a note about tolerance developing with nitrates.
Hmm.
What does that mean exactly?
It's an interesting phenomenon with long-term nitrate use. The body can become less responsive to the medication over time. Think of it like your body getting used to a certain level of stimulation.
So you might need a higher dose to achieve the same effect. That sounds like a tricky situation.
It can be. To combat this, doctors often recommend a nitrate-free period each day, usually overnight. This allows the body to reset its sensitivity, so to speak, making the medication more effective when it's needed.
It's like giving the body a chance to catch its breath and regain its responsiveness. Clever. Yeah. Okay, let's move on to a medication that I'm particularly curious about, digoxin. It's classified as a cardiac glycoside. What does that even mean?
Cardiac glycosides have a long and fascinating history. They've been used for centuries to treat heart conditions, and digoxin is one of the most well-known examples. It works by strengthening the force of the heart's contractions, making each heartbeat more efficient at pumping blood.
So it's like giving the heart a little extra oomph that makes sense for treating heart failure where the heart is struggling to pump effectively?
That's right.
But the notes mention that digoxin has a narrow therapeutic index. What does that mean in practical terms?
It means that the difference between a helpful dose and a harmful dose is very small.
Okay.
It's like walking a tightrope. You need to find that sweet spot where the medication is doing its job without causing any adverse effects.
That sounds a bit precarious. What are some of the signs that someone might be experiencing digoxin toxicity?
Digoxin toxicity can manifest in a variety of ways, including nausea, vomiting, loss of appetite, vision changes, and even dangerous heart rhythm abnormalities. It's crucial to be aware of these potential side effects and report any unusual symptoms to your doctor immediately.
Okay, definitely one to handle with care. Now let's move on to a category of medications that always sounds a bit intimidating. Antiarrhythmics. We've got a few different ones on our list: amiodarone, disopyramide, and propafenone.
Antiarrhythmics are like the electricians of the heart world.
Okay.
They work by regulating the electrical signals that control the heart's rhythm, ensuring it beats in a steady and coordinated manner.
That's a great analogy. But when we're talking about electricity in the heart, it always makes me a little nervous. Are these medications safe?
They can be very effective in treating arrhythmias, but like all medications, they come with potential risks and side effects. Amiodarone, for example, is a very powerful antiarrhythmic.
Okay.
But it can also cause a range of side effects, including lung problems, thyroid issues, and even vision changes.
Wow, that does sound a bit intense. So it's usually reserved for more serious arrhythmias that haven't responded to other treatments.
Exactly. It's a valuable tool,
right?
But it's one that we use cautiously and with careful monitoring now. Disopyramide is another antiarrhythmic often used for ventricular arrhythmias, which originate in the lower chambers of the heart.
What's unique about this one?
It works by blocking certain electrical channels in the heart, helping to stabilize the rhythm, but it can also have anticholinergic effects, meaning it can block the action of a neurotransmitter called acetylcholine.
Acetylcholine, that rings a bell from my biology class, but I can't quite remember what it does. Can you refresh my memory?
Of course, acetylcholine is involved in many bodily functions, including muscle contractions, digestion, and even memory.
Okay.
When its action is blocked, you can experience side effects like dry mouth, blurred vision, constipation, and difficulty urinating.
I see. So it's not just about the heart. These medications can have ripple effects throughout the body. That's why it's so important to understand the broader context of how they work.
Exactly.
Okay, we've got one more antiarrhythmic on our list. Propafenone. What can you tell us about this one?
Propafenone is often used for atrial fibrillation, a common heart rhythm disorder that causes a rapid and irregular heartbeat. It works by slowing down the conduction of electrical impulses through the heart, helping to restore a normal rhythm.
So it's like calming down an overexcited heart, bringing those electrical signals back into balance. That's a pretty incredible feat.
It is.
But you mentioned earlier that antiarrhythmics can sometimes worsen certain types of arrhythmias. How is that possible?
It's a bit counterintuitive,
Yeah.
but sometimes by trying to suppress one type of abnormal rhythm,
Right?
you can inadvertently create a more dangerous rhythm. It's like trying to fix one electrical problem and accidentally creating another one in the process.
That makes sense. It highlights the complexity of the heart's electrical system and the challenges of trying to manipulate it with medications. Okay, let's move on to a couple of medications that seem to be in a category of their own, nasiritide and milrinone. The notes say they're both used for acute decompensated heart failure.
That's right. They're both powerful medications used in emergency situations. When someone's heart failure suddenly worsens, nasiritide is a synthetic version of a hormone naturally produced by the heart. And it helps to relax blood vessels and reduce fluid buildup, easing the strain on the heart.
So it's like giving the heart a boost of its own natural helpers. What about milrinone? How does it work?
Milrinone works by inhibiting an enzyme called phosphodiesterase,
Okay.
which leads to increased levels of a molecule called cyclic AMP inside heart muscle cells. This ultimately strengthens the heart's contractions and widens the blood vessels, improving blood flow and reducing the workload on the heart.
Okay, that sounds a bit technical. Can you break that down for me a little more? What's the practical effect of all that molecular action?
Essentially, milrinone is like giving the heart a shot of adrenaline, but in a more controlled and sustained way. It helps the heart pump more forcefully and efficiently, especially when it's under a lot of stress.
So both nasiritide and milrinone are like emergency responders for a struggling heart.
That's a good way to put it.
But are they basically interchangeable?
They share a similar goal, helping a heart in crisis, but they work in very different ways. Choosing which one to use depends on the individual patient, their specific type of heart failure, and other factors.
Right, it's all about tailoring the treatment to the individual and their unique circumstances. Now let's move on to our last category of medications for this part of our deep dive anticoagulants. We've got two big names on our list, warfarin and heparin. What are anticoagulants and why are they so important in cardiology?
Anticoagulants, often called blood thinners, are medications that prevent blood clots from forming or getting bigger. They're essential in cardiology because blood clots can be a major complication of many heart conditions, including atrial fibrillation, heart valve disease, and deep vein thrombosis.
So they're like those little fish that clean the algae off the sides of an aquarium, keeping things flowing smoothly.
I like that visual.
But why are there so many different types of anticoagulants? Why not just have one universal blood thinner?
That's a great question. It's because the process of blood clotting is actually very complex, involving a cascade of different steps and factors. Different anticoagulants work at different points in this cascade, and some are better suited for certain conditions or situations than others.
So it's about finding the right tool for the job, just like with any other medical treatment. Okay, let's break down the specifics of these two anticoagulants. What's special about warfarin?
Warfarin is an oral anticoagulant that's been used for decades. It works by interfering with the production of certain clotting factors in the liver.
Okay.
However, it takes a few days to reach its full effect, and it requires regular blood monitoring to ensure the dose is just right.
So it's not a quick fix, and it requires some vigilance on the part of both the doctor and the patient. What about heparin? How does it differ from warfarin?
Heparin is a fast-acting anticoagulant that's typically given by injection or intravenous infusion. It works more directly in the bloodstream, binding to a substance called antithrombin, which inactivates certain clotting factors.
So it's more of an immediate response medication, often used in emergencies like a blood clot in lungs or a heart attack.
Exactly. It's a vital tool in managing acute clotting events and preventing potentially life-threatening complications.
Wow, so we've got warfarin, the slow and steady workhorse, and heparin, the rapid response team. It's amazing how much variety there is, even within a single category of medications. I'm starting to see why there's no one-size-fits-all approach to heart health.
I'm glad you're starting to see the bigger picture. It's all about understanding the nuances of each medication, the individual needs of the patient, and the dynamic interplay of all these factors.
It's like a complex puzzle, finding the right pieces to create a complete and harmonious picture of health. Well, I think we've covered a lot of ground in this second part of our deep dive. We've explored medications that affect potassium levels, blood vessel dilation, heart rhythm, and blood clotting, a truly comprehensive tour of the cardiovascular system.
It has been quite a journey.
I'm ready to see what else we have on the list for the last part of this deep dive. All right. We are back for the final stretch of our cardiac medication marathon. It's amazing how much ground we've covered, but I'm ready to see what other fascinating medications are on the list. What have we got?
We've talked about medications that target blood pressure, heart rhythm, and blood clotting, but there's one more class of drugs that plays a crucial role in managing heart health cholesterol-lowering medications.
Ah, yes. The infamous statins. They've certainly been in the news a lot over the years. Some people swear by them while others avoid them like the plague. What's the deal with statins? Are they heroes or villains?
Statins have a bit of a complicated reputation, but the truth is they're incredibly effective at lowering cholesterol levels, which is a major risk factor for heart disease. They work by inhibiting an enzyme called HMG-CoA reductase, which is involved in the production of cholesterol in the liver.
So they're basically putting the brakes on cholesterol production. That seems like a pretty straightforward approach.
Yeah.
But I know there's been a lot of controversy surrounding statins and their potential side effects. What are some of the concerns?
One of the most common side effects is muscle aches, which can range from mild to severe. Some people also experience gastrointestinal issues like nausea or constipation.
Okay, so not exactly life-threatening, but definitely bothersome. But I've also heard rumors about statins and liver damage. Is there any truth to that?
While it's true that statins can cause mild elevations in liver enzymes, serious liver damage is extremely rare. Doctors usually monitor liver function with blood tests when someone starts taking a statin just to be safe.
So it's more about being cautious and monitoring for any potential problems rather than avoiding statins altogether.
Exactly. The benefits of lowering cholesterol often outweigh the risks, especially for people who are at high risk for heart disease. It's all about weighing the pros and cons and making informed decisions based on individual circumstances.
That makes sense. Now, I know there are a lot of different statins on the market. Are they all basically the same, or are there some key differences?
They all work in a similar way by inhibiting HMG-CoA reductase, but they do vary in their potency, how they're metabolized, and their potential for interacting with other medications. Some statins are more potent at lowering LDL cholesterol, the bad cholesterol, while others might be better at raising HDL cholesterol, the good cholesterol.
So it's like having a toolbox with different types of screwdrivers. You choose the one that's best suited for the specific task at hand. Now, I see another cholesterol-lowering medication on the list that's not a statin, ezetimibe. How is this one different?
Ezetimibe works in a completely different way than statins. It blocks the absorption of cholesterol in the small intestine, essentially preventing it from entering the bloodstream in the first place.
So it's like setting up a roadblock at the border, preventing cholesterol from sneaking into the country. That's a pretty clever approach. Is ezetimibe as effective as statins at lowering cholesterol?
It's not quite as potent as statins, but it can still significantly reduce cholesterol levels. And because it works in a different way, it can be a good option for people who can't tolerate statins or who need an additional cholesterol lowering boost.
Ah, so there's another tool in the toolbox providing more options for personalized treatment. I'm curious, we've been talking about medications that lower cholesterol, but what about medications that raise it? Are there any situations where that might be necessary?
There are certain medical conditions like familial hypobeta-lipoproteinemia where people have extremely low levels of good cholesterol or HDL in those cases. Medications like niacin, also known as vitamin B3, can be used to raise HDL levels.
So it's like a balancing act, not just lowering the bad cholesterol, but also ensuring there's enough of the good cholesterol to keep things running smoothly.
Yeah.
It's fascinating how all these different players in the body work together to maintain health.
It's a delicate dance, for sure, and it highlights the importance of taking a holistic approach to heart health, considering all the factors that contribute to cardiovascular well-being.
Speaking of a holistic approach, we've talked extensively about medications in this deep dive, but I think it's important to remember that they're just one piece of the puzzle. What are some other lifestyle factors that people can focus on to keep their hearts happy and healthy?
Absolutely, medications can be incredibly helpful, but they're most effective when combined with a healthy lifestyle. Some key areas to focus on include diet. A heart-healthy diet is rich in fruits, vegetables, whole grains, and lean protein sources. It's also important to limit saturated and trans fats, cholesterol, sodium, and added sugars. Exercise, regular physical activity strengthens the heart muscle, improves blood flow, and helps control blood pressure and cholesterol levels. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week. Weight management, maintaining a healthy weight, reduces strain on the heart and lowers the risk of developing heart disease. Stress management. Chronic stress can take a toll on heart health. So finding healthy ways to manage stress, such as exercise relaxation techniques or spending time in nature, is essential. Sleep. Getting enough sleep allows the body to rest and repair, which is crucial for heart health. Aim for 79 hours of quality sleep per night. Smoking, cessation smoking, damages blood vessels and increases the risk of heart disease. Quitting smoking is one of the best things you can do for your heart health. Regular checkups, seeing your doctor regularly for checkups and screenings can help detect and manage any potential heart health issues early on.
Those are all fantastic tips.
Yeah.
It's a great reminder that we have a lot of control over our heart health through the choices we make every day.
Exactly. It's about taking a proactive and holistic approach, combining medical treatments with healthy habits to create a strong foundation for lifelong heart health.
Well said. Well, I think we've officially reached the end of our cardiac medication odyssey. We've explored a vast landscape of medications, from those that relax blood vessels to those that regulate heart rhythm and those that keep cholesterol in check. It's been an incredible journey. Thanks for joining us on this deep dive into the world of cardiac medications. Until next time, stay curious and stay heart healthy.